Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. And we've got news of yet another failure by the SNP. This was Humza Yousaf. This was his big plan to give the NHS all it needed to recover, to shorten the waiting lists, to increase the throughput of people, to make the experience better for one and all. How's that working out? Well, it's got worse than it ever has been. It's actually a new record of patient waiting. This is because, of course, anything Humza Yousaf does is destined to fail because the man is a walking failure. You look up in the dictionary the definition of the word failure, and amongst many of the definitions, one of them will just simply say Humza Yousaf. Let's have a look to see why, yet again, he's failing the people of Scotland and why now I'm going to say a record number of people will be dying on waiting lists because he cannot sort out the problems that his party have created over the last 17 years. The buck stops with him and he hasn't got a clue. Here goes. So Humza Yousaf's NHS recovery plan is less than useless as patient waiting times hit new record. Now, of course, it is definitely him. He was the one who announced it. But it's also got to be him because at the moment, Scotland is effectively without a health minister because the one person who is supposedly the health minister has got far too many other things to worry about and is incapable of doing the job. And rather than firing him and replacing him with someone who can concentrate on it, Humza Yousaf is keeping this buffoon in place. And so, therefore, it is ultimately, it's Humza Yousaf's fault twice. Once it's his plan, and once he won't appoint anyone to the role to actually make the plan work. But anyway, new figures estimates that 443,429 people waited more than 4 hours, with just 66.1% of A&E patients seen within the 95% target. That's not a dedicated failure for years now. It's an ongoing failure, but it's getting worse and worse. And why? Because rather than hiring a couple of doctors and a few nurses that would help alleviate the problems, they're spending all the money elsewhere on things that people don't want and don't need. The number of patients waiting longer than 4 hours at a Scottish emergency department reached a record high in 2023, according to the new analysis. New figures estimates that 443,429 people waited more than the 4-hour target, with just 66.1 of them seen within it. And the figures calculated by taking weekly A&E performance figures since 2016 also saw a record 141,199 wait longer than 8 hours and 56,000 waiting 12 hours or more in 2023. In 2016, the earliest year recorded, only 90,000 was seen in 4 hours. That is just 1% under the 95% target. So they've gone from 90 failing to 443 failing. 90,000 to 443,000. That is a massive increase. That alone says the failure rate of the SNP when it comes to healthcare is killing people. Meanwhile, just 7,000 people waited longer than 8 hours in 2016, while 998 waited more than 12. And again, they much smaller numbers than currently. Scottish Conservative Shadow Health Secretary Dr. Sandesh Gillane said after 16 years of the SNP, well, nearly 17 now, isn't it, years of SNP's dire workforce planning and mismanagement of the NHS, our A&E departments have spiralled into crisis. And while he's right, and we must address the elephant in the room here, while he is, of course, correct, it would carry more conviction, perhaps, if he hadn't bunged in £3,600 for some pretty photographs he expected the taxpayer to pay for. So we're not going to let him off on that one. We do have to point it out. But anyway, he continued. These shameful figures show the true damage that discredited and distracted Michael Matheson and his predecessors have inflicted on our NHS. Excessive delays in A&E have a serious impact on the entirety of our NHS and lead to unnecessary loss of life. Yet the SNP have failed to tackle the problem, whilst also failing to provide my hard-working NHS colleagues with the resources they need. They're underfunding, and they're doing it deliberately because they know that they need to put more money in, and they choose not to. They choose to put the money elsewhere, but not elsewhere into things like education or housing, where people also need help, but putting it into all the areas where nobody should be paying any money whatsoever. Independence. Patients shouldn't be left languishing when seeking medical care, he says. NHS workers shouldn't have to face such challenging working conditions. Michael Matheson needs to get a grip on this crisis or resign. He needs to be fired, not resign. Message must be sent. The number of lengthy waits jumped significantly in the years since COVID-19 pandemic, with 248,000 waits of more than 4 or more hours in 2021, and while 45,000 waited more than 8 hours and 12,000 waited more than 12. But it's ever increasing numbers, longer and longer waiting times, fewer and fewer doctors and nurses, because nobody wants to go and work in the NHS in Scotland, because the conditions are terrible, the wages are awful, and with the increasing taxes, they're even worse. They cannot attract talent, and of course the talent that is there is being more minded to move south of the border, especially when the next tax rises come in March, and when there's likely tax cuts in England. It's going to get worse. But that is the effect of SNP policy. It's what people tell them will happen. They ignore the advice, they do it, and then this happens. Leader of the Scottish Lib Dems, who unearthed the figures, Alex Cole-Hamilton, said, Humza Yousaf's NHS recovery plan has been worse than useless. It was meant to improve conditions for staff and patients in A&E and across the NHS, but these figures show we're still moving backwards. He says it beggars belief that not only are hundreds of thousands of patients enduring long waits in A&E, more and more are waiting longer every year. And it isn't, of course, just A&E. It's every department. Outpatients, inpatients, electives, every single thing. You've got diabetes, you want to come up there. Oh, we've got a long wait for that. Oh, you've had a heart murmur. Well, we'll write to a consultant and we'll get you in. And the waits are going from days to weeks to months to years. And for things like cancer, weeks matter. Weeks can change the difference, make all the difference. And people are dying. By the time they get to see the consultant oncologist, the cancer has shifted from being something that's treatable to a stage 4 terminal end cancer, simply because of the wait involved. And what should be days or a matter of a week or so is stretching out to months, sometimes many months. And by the time they are seen, it's far too late. And that is the worst of it. Because that truly is the fault of the SNP. People are being buried because the SNP refuse to put money into the NHS because the money can only come from independence. I'm coming up. What I say to any SNP voter watching this video is this. When someone in your family gets cancer and then doesn't get referred for 8, 10, 12 weeks, and by which time it's a stage 4 cancer and they're going to die, just know that you've done that. You've caused that because you voted for the SNP. And instead of putting money into the NHS, they are spending it on foreign embassies so friends and relations of theirs can have nice little lifestyles in little foreign cities, going, oh, look at us as we sit here and do sod all work. Meanwhile, your wife, your child or whatever is dying of cancer that could have been treated only for the fact that you voted for the SNP. There you go. What wonderful people you truly are. Anyway, thank you very much for watching. I'll finish there. Do please hit the subscribe button, ring that bell, leave a like, leave a comment, please share the video. And until next time, stay safe, stay well, and I will speak to you later. Bye.